Beverly Allitt, or the Angel of Death as she would later become known, exhibited some worrying tendencies early on while growing up as one of 4 children, including wearing bandages and casts over wounds that she would use to draw attention to herself without actually allowing the injuries to be examined. Becoming overweight as an adolescent, she became increasingly attention-seeking, often showing aggression toward others. She spent considerable time in hospitals seeking medical attention for a string of physical ailments, which culminated in the removal of her perfectly healthy appendix, which was slow to heal as she insisted on interfering with a surgical scar. She was also known to self-harm and had to resort to doctor hopping as medical practitioners became familiar with her attention-seeking behaviors. Allitt's behavior in adolescence appeared to be typical of Munchausen syndrome, and when this behavior failed to elicit the desired reactions in others, she began to harm others in order to satisfy her desire to be noticed. She went on to train as a nurse and was suspected of odd behavior, such as smearing feces on walls in a nursing home where she trained. Her absentee level was also exceptionally high, the result of a string of illnesses. Her boyfriend at that time said later that she was aggressive, manipulative, and deceptive, claiming false pregnancy before the end of the relationship. Despite her history of poor attendance and successive failure of her nursing examinations, she was taken on a temporary 6-month contract at the chronically understaffed Grantham and Kesteven Hospital in Lincolnshire in 1991, where she began work in the children's ward. There were only 2 trained nurses on the day shift, and 1 for nights when she started, which might explain how her violent, attention-seeking behavior went undetected for as long as it did. Crimes. On February 21, 1991, her first victim, 7-month-old Liam Taylor, was admitted to the children's ward with a chest infection. Allit went out of her way to reassure his parents that he was in capable hands and persuaded them to go home to get some rest. When they returned, Allit told them that Liam had suffered a respiratory emergency, but that he had recovered. She volunteered for extra night duty so she could watch over the boy, and his parents chose to spend the night at the hospital as well. Liam had another respiratory crisis just before midnight, but it was felt that he'd come through it satisfactorily. Allit was left alone with the boy, however, and his condition worsened dramatically, becoming deathly pale before red blotches appeared in his face, at which point Allit summoned an emergency resuscitation team. Allit's nursing colleagues were confused by the absence of alarm monitors at the time, which had failed to sound when he stopped breathing. Liam suffered cardiac arrest, and despite the best efforts of the attending team, he suffered severe brain damage and remained alive only with the help of life support machines. On medical advice, his parents made the agonizing decision to remove their baby from life support, and his cause of death was recorded as heart failure. Allit was never questioned about her role in Liam's death. Only 2 weeks after Taylor's death, her next victim was Timothy Hardwick, an 11-year-old with cerebral palsy, who was admitted following an epileptic fit on March 5, 1991. Allit took over his care, and again following a period when she was alone with the boy, she summoned the emergency resuscitation team, who found him without a pulse and turning blue. Despite their best efforts, the team, which included a pediatric specialist, were unable to revive him. An autopsy later failed to provide an obvious cause of death, although his epilepsy was officially blamed. Her third victim, 1-year-old Kaylee Desmond, was admitted on March 3, 1991, with a chest infection, from which she seemed to be recovering well. 5 days later, with Allit in attendance, Kaylee went into cardiac arrest in the same bed where Liam Taylor had died a fortnight before. The resuscitation team were able to revive her, and she was transferred to another hospital in Nottingham, where attending physicians discovered an odd puncture hole under her armpit during a thorough examination. They also discovered an air bubble near the puncture mark, which they attributed to an accidental injection, but no investigation was initiated. 5-month-old Paul Crampton became Allit's next victim, placed in the ward on March 20th, 1991, as a result of a non-serious bronchial infection. Just prior to his discharge, Allit, who was again attending a patient by herself, summoned help as Paul appeared to be suffering from insulin shock, going into a near coma on 3 separate occasions. Each time the doctors revived him, but were unable to explain the fluctuation in his insulin levels. When he was taken by ambulance to another hospital in Nottingham, Allit rode with him. He was again found to have too much insulin. Paul was extremely fortunate to have survived the ministrations of the Angel of Death. The next day, 5-year-old Bradley Gibson, a pneumonia sufferer, went into unexpected cardiac arrest, but was saved by the resuscitation team. Subsequent blood tests showed that his insulin was high, which made no sense to the attending physicians. Attendance by Allit resulted in another heart attack later that night, and he was transported to Nottingham, where he recovered. Despite this alarming increase in the incidence of unexplained health events, all in the presence of Allit, no suspicions were aroused at this time, and she continued her spree of violence unchecked. On March 22, 1991, 2-year-old victim Yik Hung Chan turned blue and appeared in considerable distress when Allit raised the alarm, but he responded well to oxygen. Another attack resulted in his transferal to the larger hospital in Nottingham, where he recovered. His symptoms were attributed to a fractured skull, the result of a fall. Allit next turned her attention to twins Katie and Becky Phillips, just 2 months old, who were kept in for observation as a result of their premature delivery. A bout of gastroenteritis brought Becky into the ward on April 1, 1991, when Allit took over her care. 2 days later, Allit raised the alarm, claiming that Becky appeared hypoglycemic and cold to the touch, but no ailment was found. Baby Becky was sent home with her mother. During the night, she went into convulsions and cried out in apparent pain, but when summoned, a doctor suggested she had colic. The parents kept her in their bed for observation, and she died during the night. Despite an autopsy, pathologists could find no clear cause of death. Becky's surviving twin, Katie, was admitted to Grantham as a precaution, and unfortunately for her, Allit was again in attendance. It wasn't long before she was again summoning a resuscitation team to revive Katie, who had stopped breathing. Efforts to revive Katie were successful, but 2 days later, she suffered a similar attack, which resulted in the collapse of her lungs. Following another revival effort, she was transferred to Nottingham, where it was found that 5 of her ribs were broken, in addition to having suffered serious brain damage as a result of her oxygen deprivation. The trial. After numerous delays due to her illnesses, as a result of which she had lost 5 stone in weight, she went to trial at Nottingham Crown Court on 15 February 1993, where prosecutors demonstrated to the jury how she had been present at each suspicious episode, and the lack of episodes when she was taken off the ward. Evidence about high readings of insulin and potassium in each of the victims, as well as drug injection and puncture marks, were also linked to Allit. She was further accused of cutting off her victims' oxygen, either by smothering or by tampering with machines. Her unusual behavior in childhood was brought to light, and the pediatrics expert, Professor Roy Meadow, explained Munchausen syndrome and Munchausen's by proxy syndrome to the jury, pointing out how Allit demonstrated symptoms of both, as well as introducing evidence of her typical post-arrest behavior and high incidence of illness, which had delayed the start of her trial. It was Professor Meadows' opinion that Beverly Allitt would never be cured, making her a clear danger to anyone with whom she might come in contact. After a trial that lasted nearly 2 months, and at which Allit attended only 16 days due to continued illness, Allit was convicted on 23 May 1993 and given 13 life sentences for murder and attempted murder. It was the harshest sentence ever delivered to a female, but according to Mr. Justice Latham, it was commensurate with the horrific suffering of the victims, their families, and the ignominy she had brought upon nursing as a profession. Indeed, the impact on Grantham and Kesteven Hospital was so severe that the maternity unit was closed down altogether. The aftermath. Rather than going to prison, Allit was incarcerated at Rampton Secure Hospital in Nottingham, a high-security facility mainly housing individuals detained under the Mental Health Act. As an inmate at Rampton, she began her attention-seeking behavior again, ingesting ground glass and pouring boiling water on her hand. Allit subsequently admitted to 3 of the murders for which she was charged. The appalling nature of her crimes placed her on the Home Office list of criminals who will never be eligible for parole. In the end of this video, don't forget to push like and subscribe, video for supporting us, to make more content.